This is the business of Africa. If it's about Africa, then it's our business, bringing big and small business issues right to your doorstep. At its 68th meeting in May of 2015, the World Health Assembly, the highest policy-setting body of the World Health Organization, adopted the Global Technical Strategy for Malaria 2016 to 2030. Now, the strategy provides guidance to member countries and highlights the pressing need to increase investment across all interventions, including preventative measures, diagnostic testing, treatment and disease surveillance, as well as harnessing innovation and expanding research where malaria is concerned. And 47 African countries are WHO members. Now, with 2030 around the corner, we review how the fight against malaria is faring, more so in the face of aid cuts. Dr. Chris van Straten is Global Health Advisor, Clinical Governance at International SOS, and he joins us now to take a look at this. Thank you very much, Doc, for your time. I think with the prevalence of more and more, what would you call them, pandemics in the world, we sort of taken malaria and put it on the back, if you will. Like virtual reality, take us on a tour of a typical day, more so in a malaria-infested area. What does your day look like? What do you see? What do you hear?
Hi, good morning, and thanks so much for inviting us back on the show. So good, I'm Dr. Chris van Straten. I've been working for International SOS for about 15 years now in different parts of the world, from Papua New Guinea across to many parts of South and Southern Africa. So we're seeing malaria daily, unfortunately. We are a multinational company that works with other big multinational companies to really support their duty of care. In other words, let's say you're a big mining company in Angola, or you are a factory manager in the DRC, and you have staff and boots on the ground and supply chains in those countries. What we're currently seeing is that the number of malaria cases in many instances are going up, and we're seeing more, and we're treating more malaria cases daily. And unfortunately, we're also seeing some areas with resistance to some of the treatments that we have, and we're also seeing unnecessary deaths. So that's pretty much what we're seeing daily, boots on the ground.
What do we put this increase down to in terms of the number of malaria cases being on the up?
Yeah, brilliant question. And it's a bit of a complex question with a complex answer. So first off, if you'd asked a very nerdy person like me in 2019, Dr. Chris, are we going to beat this thing called malaria? My answer would have been yes. And the reason for that is we actually, even back in 2019 and before that, we actually have many of the tools for eradicating malaria. And in fact, in the last couple of years, countries like Egypt have been declared malaria-free. It can be done, right? It takes a lot of initiative, private government, NGO collaboration, but we've got the tools. It can be done. And then 2020, a couple of things happened simultaneously. What's like the perfect storm? The first being COVID-19 hits us, and a lot of funds, energy gets diverted away from other conditions that we had on the back foot, like malaria. And now we're having to focus on other conditions. Then recently, the big fund cuts from various parts of the world have certainly put us in a slightly tighter position, but also the malaria mosquitoes, the Anopheles mosquitoes, they are tough, they're able to mutate and change, and so is the actual parasite. So we've seen a change in some of the resistance patterns, and some of this is due to impacts on climate change. Let me give you a good example. When we were kids, we went to the Kruger Park, the northern part, in winter because it was dry, it was cold, and we could see all the animals because the grass was short. Now, when I go to the Kruger Park in winter, I go taking malaria prophylaxis and mosquito repellents. Why? Because it's cold, it's wet, it's warm, the grass is tall, and we're having to treat people who got infected through malaria. So you've seen this perfect storm of all these different components coming together, and it's put many African countries again on the back foot. And this World Malaria Day, 25th of April, with the WHO is a great time to just refocus and say, we can get it done. We know we can get it done. But we've got to refocus, regroup, focus our funding, and get private businesses to be part of this.
Are there other regions outside of sub-Saharan Africa or continents outside of the African continent that are dealing with malaria at such a scale? Maybe even if it's not such a scale, right? How did they get it right? Because you rightfully mentioned that this is something that can be done away with. And so where can we point to and say, this is done away with and they're clear and this is what they did?
Sure. Now, each country will be slightly different. And I'll give you an example. One of the islands where we worked in Papua New Guinea 15 years ago, and in parts of Africa, if you've got a small geographically contained location, it's really not, it can be done. You've got small population there, you can control the amount of mosquitoes coming in and out, where they breed, and using the right treatment and focus programs, you can eradicate malaria and malaria transmission. And in fact, here's a very good example. Parts of America eradicated malaria over 100 years ago. But in fact, if you watch the headlines from last year, you would have seen quite a couple of endemic cases, in other words, picked up in southern parts of America. And it's because people have climate change, people have become not taking some of the science as seriously as they could or should. And you can and will see a resurgence. Parts of Vietnam has been battling malaria for a long time, and you've seen instances, especially along the border, where some resistant mosquitoes have come in and down, disrupting their program somewhat. And a third example, and a good one, is South Africa. South Africa has potential to eliminate malaria, and we were on track to eliminate malaria, and I think we still will. But where we border, for example, up in the north and the east, countries with heavy transmission, especially due to the recent very heavy flooding. We're going to have a very focused arrangement there to make sure we prevent it spilling back over and support our neighbors like Mozambique and Botswana in reducing and eliminating malaria.
You mentioned the cut in funding. How should we understand financing around malaria in trying to gauge the impact that this will have or has had?
Excellent question. So the financing is always important. Money is an important thing, and it's a powerful thing, but it's not the only thing, right? And what I feel optimistic about is the following. So one, within the African continent and the African CDC and SADC, the initiatives that are underway, and in fact, many of the African countries that have now incorporated these new and effective malaria vaccines into childhood vaccination schedules, that's smart. And that's using money very wisely and in the right way. And the other aspects of this too are using the tools we already have. And what I would like to emphasize is the work that we do, and I've been doing daily for 10 years, is working with companies, mid-sized to large-sized companies in these countries, and looking at, okay, so let's say you have a mine sitting here in the DRC, and we've done this, it was amazing work, is you say, okay, you've got so many X people sick per month with malaria. How do we prevent that on this particular mine site? And step one was to measure it, figure out what mosquitoes are there, who's getting sick, how sick they're getting, how do we test it, how do we treat it? The second part was then going, how do we improve the local communities that support this project and this mine and make sure that they're educated, that they have mosquito nets, that they have access to the appropriate treatment regimens. And over a 5-year period, malaria in that particular area and local villages was reduced by over 50%, and a significant number of deaths prevented, and also significant save financially for that particular business entity. So that's being smart, and that's what I'd like to see more of, and what we're certainly trying to do as a business in Africa and Southern Africa.
What is their responsibility in making sure that this is brought under comfortable control, if you will?
Well, another question, by the way, because it's always shared responsibility, right? And I'll give you a very good example. So this is something I still see, and it's something I'm still struggling with cognitively, but also emotionally. So first off, the first severe malaria case I treated was 16 years ago in Papua New Guinea. I'm a reasonably junior doctor, and an 18-year-old boy, he was going to be the first person in his family to go study at university. He'd gotten sick. His family had taken to a local faith healer who'd missed the fact that he had malaria. And he then went into a coma. When they brought him to us, he was pretty much at death's door, we were able to save him, but only just. And he did survive. When he came out of his coma, he was permanently paralyzed on the left-hand side of his body. So malaria can and does kill people, but it can also permanently damage you. It can damage your brain with micro-infarcts. It can damage your kidneys permanently. It can damage your liver permanently. So he was this 18-year-old boy, super smart, who was never going to leave home. He was going to be probably in a diaper and spoon-fed for the rest of his life. And I've carried that case with me pretty much most of my career. And something I still see, and I see it daily, I see really, really smart men and women. These are men and women who are running multi-million-dollar companies, often CFOs or CEOs, and they get on airplanes and they fly to Luanda, and then they fly to Nairobi, Kenya, and then they fly to Paris, and they meet with other multi-million-dollar companies. But in Paris, that individual get headache and joint ache and pain. They'll go to the local doctor and they say, hey, I feel like I got flu. And they don't tell the doctor that they've been traveling and that they've been in a malaria area. And a week later, they pass away in hospital from malaria. And it plays out, unfortunately, every couple of weeks. I see this very, very often. So I think it's a good time for all of us to take stock of a disease that has plagued us for millennia and to realize that it's, one, completely preventable. Two, it's completely treatable if you detect it early. So three, to kind of finally answer your question, all of us need to remain aware that it's out there. If we're traveling, research where you're traveling. Make sure you're fully protected. Prevent the mosquito bites. Take the prophylaxis. And if you return from traveling from a malaria area, even if it's months later, you have to think about it and tell the treating clinician that they've got to exclude malaria. It can literally be life-saving. So I hope that's useful.
Absolutely. I mean, the story that you share, please bear with me because my question is going to be quite long. You said something that really put into words what I could not find while I was doing the research to this. Your cognitive and emotional struggle. I struggle with that with a lot of things on the African continent because there seems to be a struggling in perpetuity, if you will. So there's a couple of reports on malaria, and there's the AU malaria progress reports, and from what I saw on this particular website, it's dated from 2018 to 2025 in terms of the progress that is being made. So please do bear with me, Doc. In 2018, it notes, these are just some of the highlights that I took from these reports. 2018, Zero Malaria Starts With Me campaign is launched. And here, African heads of states, they gather each year, and this is what they found around this. They say funding stalled or stagnated, and progress towards fighting malaria stalled. 2019, progress stalled. Malaria incident rate plateaued since 2015, showing slowing progress. 2020, like you characterized for us, it was a more optimistic read, and they were talking about how the regional economic communities were developing work plans to address malaria at regional levels, and we're on track to achieve the 2020 target of reducing malaria incidence and mortality by 40%. 2021, AU did not achieve this target, and it goes to what you speak to in terms of COVID-19. 2022, progress remains stalled. 2023, despite political will and knowing how to defeat malaria, we lack resources to fully implement national strategic plans. These are what the heads of states were saying. And in 2024, like you mentioned, Cabo Verde and Egypt are declared malaria-free. I ticked that and I was like, great. But progress remains stalled. 2025 is make or break year. This is what they noted. And in 2025, the Global Fund replenishment will determine if we sustain or fall behind on progress in terms of fighting malaria. And so naturally in my mind, I think, what is it really? Because yes, we note things that are beyond our control, like climate. One, are there things that are in our control? The government heads of states talk about, in spite of a political will and knowledge of how to defeat malaria, we lack the resources to fully implement this. It would appear as if monies have been thrown into this. There's so many resources that have been thrown into it. I mean, there's also a number of organizations, African Leaders, Malaria Alliance, RBM partnerships to end malaria councils, etc., etc. What is it that we are not? At this moment, I thought to myself, geez, we need divine intervention. But if this is something that can be done away with, what seems to be the disconnect?
Oh, good question. And again, super complex. And I think we need to regroup at some point and take a couple of hours to discuss it. One, Africa, as you know, is a huge continent made up of many distinct countries. So let's use South Africa as a good example. Where I'm sitting right now, I'm down in the Western Cape. It's very cold. It's getting really wintry. And I'm not at all concerned about picking up malaria down here, because the mosquitoes can't breed here, they can't replicate here, and it's the Anopheles paris, or a mosquito hasn't been found here, and neither has the malaria parasite. When I get up north to northern parts of KZN or Limpopo, we know that there, because it's hot, there's lots of freestanding water, especially after the big recent flooding. We know that the mosquitoes can travel, especially if the winters, for example, in Mpumalanga and that have been shorter and warmer. It's easy for them to replicate and for them to continue. So there the intervention needs to be focused on the vector control in terms of measuring where the mosquitoes are and preventing them from traveling further. And for example, that's the kind of location in and across the border where one definitely wants to have focused, let's say, vaccinations or eradication campaigns. If you're talking somewhere in the middle of Angola or the DRC, there it's a different picture because it's often throughout the year transmission. There's high levels, especially amongst younger kids, of getting infected and dying. That really needs to be focused on the local communities and the health systems and the vaccinations and I think the duplicates. So what I'm trying to get to is this one, it will vary from location to location, which is where it's difficult to sum it all together for one particular continent or paint each country with the same brush. I think that's a mistake that can be made. And the second part is, I think you kind of alluded to it, it's really about all of us coming together on this. I don't think it's fair to stay. I don't think a government on its own can solve this. It needs to be intergovernmental. Africa's CDC, the NGOs, the private sector. And to that too, I want to say there are amazing collaboration efforts that are working and is gaining ground. And I'm thinking now of people like the Bill and Melinda Gates Foundation and the funding that's come from Gavi into the vaccines. Because here's an important thing most people don't realize. 90% of deaths plus that happen every year because of malaria are in Africa. And most of those deaths are in kids under the age of 5, right? And those kids are the kids that need the vaccinations. Those are the kids that need these fantastic new mosquito nets with the dual impregnated prevention measures. Those are the kids that need access to a local clinic that can do follow-ups to see if they're getting recovered from their malaria, need any further treatment, etc. So it's really about knowing where the hotspots are and being able to measure that, and getting government and private and the different institutions from the different ministries of health together. I still think it can be done. I still know, though, realistically, it's a long and hard journey. I don't know if it'll be within my lifetime, but if we can continue, like we've done with Egypt, to one step at a time. Sometimes it's 2 steps forward, 1 step back, 3 steps forward, 1 step back. But if that's a dance we have to dance, so be it. But I still think it can be done.
I am learning that perhaps you might not see it in your lifetime. I am so learning that, so I appreciate that, and I hear it. In just closing up the conversation, Doc, I guess your call to action more so in the face of these aid cuts.
Yeah, well, they're hard, but they're realistic. Well, that's real. It's what's in front of us. And what the important thing now is we need to be, this is where I love being African and also South African. We're incredibly tough and we're incredibly adaptive. So we will take the punches and we get on and figure out what the next steps are to make this happen for the next generation and the next generation. And here's the thing too, with the current tools, as we said right in the beginning, it's still a preventable disease and it's still a treatable disease. So next time you're getting on a plane anywhere, please do your homework, figure out how you can prevent being bitten, and make sure you take the right treatment. And should you present with any of the symptoms and signs, make sure that you report to a healthcare provider who can test you and treat you if needed.
Dr. Chris van Straten, Global Health Advisor, Clinical Governance at International SOS. Thank you so much, Doc, for your time.
Thanks for your time.
Thank you very much for tuning in to the Business of Africa podcast, where we bring big and small business issues right to your doorstep. You'll hear from us again in the next fortnight, God willing. Bahaichu. Bula.